Your menopause symptoms are making you pretty miserable. So you turn to your doctor for help. But can they actually prescribe hormone therapy? For a lot of women, the first person you might think of is your family doctor, your OBGYN, your primary care provider. But is that really the best place to go? The real question is this: is your doctor both, number one, willing, and number two, qualified to help you with your hormones? Well, I've developed a simple framework to help you have an open, honest, non-confrontational conversation with your doctor so that you can decide for yourself if they're the right person who can help you. Before we talk about that, though, let's talk about why so many doctors basically refuse to prescribe HRT and why it's not necessarily their fault. I hear from women all the time who feel completely dismissed, ignored, even gaslit when they ask about HRT. My doctor refused to prescribe hormone replacement, saying it was to protect me. I could just scream. Nobody ever told me about hormones for menopause. I've seen multiple doctors and not a single one has explained this whole thing to me. Well, I've suffered for years. My doctor flat out refuses to prescribe hormones. My wife's OBGYN says there's nothing she can do to help her. So what happens next? Do you just give up? Do you assume that there are no options, or worse, that you're just crazy for thinking that hormone replacement therapy might help you? Well, that's pretty unfair to you. So if you've ever felt misunderstood, not listened to, like your doctor just doesn't get it, I know you're not alone because I've heard from lots of women just like you. I can only imagine how frustrating that must be for you. But it's not really your doctor's fault. Most primary care doctors and OBGYNs aren't really trained in menopause and hormones. Recent surveys of residents just fresh out of medical school show that 20.3% of family practice doctors and OBGYNs get 0 menopause lectures in their entire training. 34.4% would not prescribe HRT to a newly menopausal woman even if she had symptoms. And only 6.8% of doctors feel prepared to manage menopause at all. So let's be clear. It's not that your doctor is cruel. It's not that your doctor doesn't care about you. And hopefully it's not that your doctor doesn't want to help. They just don't know how. Most doctors have had less than 2 hours of menopause training in their entire medical school and residency curriculum. And the little training they did get, well, it was probably based on outdated misinformation, mostly from the Women's Health Initiative study from over 20 years ago. Now, some doctors go out of their way to get more training in menopause and hormone optimization, but unfortunately, most of them just don't because they don't really realize what they're missing. How do you figure out if your doctor can actually help you with your hormones? Well, that's why I created the HRT Questions Framework. It's a simple guide to help you ask the right questions and feel confident about who you can trust with your hormones. Before you assume that your doctor can't help, download that framework and start that conversation. Here's how it works. You can ask your doctor a few key questions. The framework gives you exactly what to say. Listen carefully to your doctor's answers, maybe write those answers down. There's even a spot on the framework to write them down. And then decide if you feel comfortable moving forward. Your doctor's responses will tell you everything you need to know about whether they're willing, first of all, and qualified to help you. If they seem open, curious, engaged, maybe you're in luck. If they shut you down, dismiss your symptoms, or say that hormones are just dangerous, well, it might be time to look for a different healthcare provider. Either way, the framework puts you in control. Go to simplehormones.com/HRT-questions to download that framework. One of the biggest myths I see women believing is this: if my doctor won't prescribe hormone replacement, it must mean I shouldn't take it, right? Well, just because one doctor doesn't understand hormone replacement, hormone optimization, doesn't mean it's not right for you. Think about it this way. If your car breaks down and you take it to a mechanic who says, well, I don't know how to fix it, do you just accept that your car is dead? Take it straight to the junkyard? I would guess probably not. You might look around for another mechanic who knows what they're doing with your particular car and actually understands the problem, maybe knows how to fix it. If your doctor can't or won't fix the issue in menopause, it might be time to find somebody who knows how. And that brings me to my next point. If you go through my HRT questions framework and you decide that your doctor isn't really the right fit for your menopause, what do you do then? Well, you may still need someone who knows what they're doing. That's where a hormone optimization specialist might come in. These are doctors, nurse practitioners, physician's assistants who have taken the extra time to truly understand menopause and hormones, hormone optimization. They've attended continuing medical education conferences. Many of the ones I know have earned certifications in hormone optimization. They have experience in dealing with the pitfalls and the nuances and the roadblocks that inevitably come up in optimizing patients' hormones. Watch my next video to learn more about these providers who truly understand menopause and hormones. These are qualified, experienced hormone specialists who not only have the empathy to care, they also have the know-how to be able to make a difference for you. Click here to watch that video now.